Hi, good day everyone. I'm Dr. Raghu Ramasamy. I'm a consultant general and colorectal surgeon at Avicenna Specialist Hospital, Shah Alam, and also a visiting consultant at Subang Jaya Medical Center, Subang Jaya. Today, I would like to share some information and the topics of hemorrhoids and fistula to clear the air on commonly asked questions and misconceptions regarding this topic. This is a very common condition that affects the general population, but it's very embarrassing. They find it very embarrassing topic to discuss, and it's also sensitive to some people. They worry because patients are worried about the incontinence, patients worry about they will be lying down on the bed and the pain of the treatments. So today, I hope I can allay some of these worries and concerns from you. Nowadays, many people ask Dr. Google when they have questions about medical problem. Why? It's convenient, easy. I have no problem with that. I think everybody should be able to Google, and you can, if you get the information from a correct and certified site, it should be good. Now, let's see what appears online when I first type about hemorrhoids. A lot of patients of mine ask me, Doctor, is there any medications that can cure my hemorrhoids? I will always tell them, not all hemorrhoids needs to be operated. The first line of treatments is usually medications. And we have a few medications that we usually prescribe for patients who come in early. That means you're coming with grade 1 or 2. And this is accompanied with a change in lifestyle. We do not only advocate to take medicine, but also a change in lifestyle. That means your toilet habit, your dietary habit, your drinking habit, your also exercise. Exercise is also important because most of these patients are constipated. They are trying their best to evacuate, they're straining, and exercise helps to alleviate this constipation. A lot of fluids and fibers. So all these will be brought together as a first line of treatment, and which is also a conservative treatment. Not all patients will require surgery, but over the time, if they do not change their bowel habits, they do not change their way of going to toilet, they do not take enough fibers, patients do not take enough fluids, this thing can progress. Second commonly asked question will be, when I have a per rectal bleeding, is it from colon cancer or is it from hemorrhoids? It's a very common question that I get. Bleeding from hemorrhoid can be bright red. Bleeding from colon cancer can also be bright red. So it's very difficult sometimes to tell which one is cancer and which one is hemorrhoid. Hemorrhoidal bleeding usually occurs after when you're going to the toilet, when the poo comes out, or it can also drips into the toilet bowl at the end of the defecation. It's usually bright red and it's usually painless. Same goes to per rectal bleeding caused by cancer. It can also be painless, and most of the time it is. So it's very difficult to differentiate these, and usually these will require a colonoscopy. This is why your doctor sometimes suggests to do an endoscopy, which is a colonoscopy, to get a better understanding of the colon, to see whether you're bleeding from any other causes like cancer. You can be bleeding from polyp. So this is something that we normally do. Another common question that I get is, after surgery, doctor, will the hemorrhoid come back? Yes, this is something that can come back. That depends on how the patient changes after we have done the hemorrhoidectomy or laser hemorrhoid or any type of procedure. It doesn't matter, but if you do not change your toilet habit, do not change the dietary habit, do not change how you go to toilet, and all these the predisposing factor which was there in the first instance will come back and cause the patient to have the hemorrhoidal symptoms again. And sometimes they ask me, how long does it take? But there is no definite time period for how long does it take, but it can come back to you. The hemorrhoid is a common condition affecting many of you, and I always see that patient come at the delayed stage because they are worried, or their concern is regarding pain. They are worried to see doctors because they worried they have to have a surgery. Many stages of hemorrhoid can be treated with medication, and if your symptoms is getting worse, or if you're coming at a grade where we think you need surgery, there are options. There are many minimally invasive options that's available, and also there are cutting options and also stapler options that's available for the patient. So depending on how bad is the hemorrhoid, that's how we proceed. And patients do not have to be too worried about the risk. Nowadays, we can reduce the risk of surgery by doing this minimally invasive technique. Thank you. I'll see you in the next video.